was 2019 when I was enjoying my college life at Indian Institute of Management, Raipur, and I happened to make a visit to the village of Bastar, where I observed that for every 20,000 people, there was only one primary healthcare center. And sometimes this PHC did not even have a single doctor. On speaking with the people, I observed that they had multiple health problems like chronic conditions, diabetes, cataract, etc. However, they were unaware of their health problems. They may have eye problems, but they were unaware about it. Sometimes they went for the surgery when it was too late and when the problems were actually much more complicated. It is said that in India, every household has an eye patient. However, they are unaware about it. Cataract disease, which is basically a clouding of the eye, is responsible for 70% of blindness in India. I soon realized that primary healthcare screening, or the first level of health intervention, was broken in our country. I came across this amazing technology called artificial intelligence, and I soon realized that AI can be leveraged to actually fix this broken healthcare system. With this excitement, I opted out of my placements and directly started working on fixing this huge healthcare problem in India. And in this journey, I was really lucky to have been assisted by some amazing friends. So before we dig deeper into how AI can actually solve this broken healthcare system, let us first understand what is artificial intelligence. Well, artificial intelligence is nothing but the simulation of human senses like seeing, touching, hearing, and replicating and comprehending them into machines. So you may wonder that how AI can actually solve this broken healthcare system. So let me explain this with an example. So if you look at any patient journey, it primarily has three different parts. The first stage is basically the awareness stage. This is the stage where somebody becomes aware of their health problems, which they were previously not aware of. The second stage is basically the consultation or the treatment phase. This is post the awareness when they come to the care provider to take a treatment. And the last stage is basically the follow-up stage, which is after taking the treatment, how they would sort of follow up and stay in touch with the care provider. Now, if we fundamentally look at all these three phases, I feel the first stage or the awareness phase is the most critical stage, because that is where we actually make somebody aware of their health problems. And this is where, due to the lack of early health interventions and lack of awareness, our healthcare delivery model in India primarily becomes reactional and transactional in nature, and it lacks the continuum of care. Hence, leveraging AI in creating a digital health front door to help somebody get early interventions of their health problems can possibly transform this reactive mode of care to a more proactive and value-based care model. Let me explain this with an example. There are only 10,000 plus ophthalmologists in our country. And that is the reason why cataract screening is primarily broken, because these doctors or these educated resources cannot always travel. And due to the resource constraints, cataract screening is not very widely happening in our country. Now imagine this, cataract being the biggest reason for blindness, and yet we are not able to do mass level of screenings. This is exactly where AI can help. Any young person in the family and having a smartphone can actually take images of the elderly people in their house, and by taking their eye images and using AI, they can actually predict whether that person has a cataract or not present in the eyes. The AI models, which is highly researched and sophisticated and trained with thousands of eye images, can, at least with 90% plus accuracy, predict the pattern in the images of the eye that has been taken and try to assess that whether there is a presence of early immature cataract or mature cataract or not. This AI prediction takes less than 1 minute. Yes, it takes less than 1 minute, and this can help in giving the households a very early intervention so that they can take an action upon it. Like, for example, when should they do the surgery? Is it a very late stage cataract that they need to do the surgery in the next 1 month? This early intervention is possible to give with the help of AI. These images can then be further sent to the consultant ophthalmologist in the nearest hospital or the clinic, and they can further cross-verify these images and help the patient in understanding that when the surgery should be needed, or is it actually a very, very critical stage. This is exactly what we call as the human in the loop system, or a more supervised way of implementing AI in public healthcare. Now, is this a distant dream today? No, this is a reality today. Today, thousands of youngsters are actually using just their smartphones to screen elderly people for cataract. An estimated 190 plus million elderly people in our country, India cannot miss the opportunity of implementing AI for early health interventions and screenings. With the implementation of AI, we can actually transform the health delivery system and convert it from the hospital to the home. And this is exactly where I see two massive tectonic shifts happening in India currently. The first, every care provider, whether be it a clinic or a hospital, will need an AI-based digital health front door to actually engage directly with the users. Care delivery would start from the home. Hence, a person would only travel to the hospital or the clinic for taking the necessary treatment. And this is where I exactly see that tele-adoption is going to be huge. And this is where AI can actually be leveraged for saving lives. This is an image of many villagers who have done their cataract surgery. Post, they were screened by AI for detecting early intervention for presence of cataract in their eyes. Isn't this transformational? Isn't this truly a game changer? Now, why today do we need to take the leap of faith in AI? Well, India, with a population of 1.3 plus billion people, needs to transform its transactional sick care model into a more proactive and value-based creation healthcare model. Think about the times when you needed to travel to the clinics, traveling several hours from far distances with your parents maybe, and waiting there at the clinic for several hours just to meet the doctor for 2 minutes to get that early intervention. Well, with AI, this system can change. With AI, we can possibly give the power back to the patients at their home. AI shall be potentially useful to classify and filter the priority versus non-priority cases. Let me explain this. So let's say that there are 1,000 people who have been screened with AI. Now, this AI system can actually say that, hey, this 800 people may be completely fine, and this 200 people or 20% of the people may have chances of some healthcare problems. Now, the data for this 200 people can then be further shared with the nearest hospital or care provider, and that is how the care journey can start directly from the home. Unlike human, the AI system doesn't get fatigued, and it is highly accurate too. And with the lack of doctors in our country, and with only few lakhs of doctors who cannot always reach the remote places at the right time, and with a heavy smartphone penetration in our country, I see that AI can actually bring equitable health in our country by letting our healthcare systems reach places, the remote places where our healthcare resources today cannot travel. Well, fundamentally in the future, the hospital will come to the home, and the care journey will start from the home and not the hospital. And with the massive amounts of research and development that is happening in AI today, AI can be very well leveraged today for early interventions of chronic conditions, diabetes, cataract, dental care, hypertension, and can be used to create a layer for early intervention of health problems. Today, more than ever, we need doctors who are proactive in nature. We need doctors who are the digital doctors, and they are very used to using the smartphones and the digital systems. And we need doctors who can actually embrace and appreciate the potential that artificial intelligence has to transform the healthcare system. The India in the future will be an India which is proactive towards healthcare and not reactive. And India, with its various policies and the infrastructure which it is setting today, if there is any time to be actually working on transforming and fixing this broken healthcare system, that time is now. That time is today. And this is exactly why I took the leap of faith to transform our healthcare system with AI. And I believe that after hearing this talk, you would also have the leap of faith on AI. Thank you. Namaste.